Hi, I'm Tamara Taggart, and you are listening to the first episode of our TELUS Talks Health podcast. To kick off our first show, our guest is Dr. Diane McIntosh. She's a psychiatrist, author, university professor, mental health advocate, and most recently, Chief Neuroscience Officer at TELUS. Diane, thanks for being here.
Thanks for having me.
What does the Chief Neuroscience Officer at TELUS mean?
That's a very good question. I think it means that TELUS, which has become actually the largest healthcare company in Canada, is taking mental health very seriously. So they've invited me to, as a psychiatrist, to come in and to influence how they move into mental health and all of the products and services they offer. So I think they viewed it as a great, important aspect of the business to make sure that not only they are taking care of people's physical health, but also their mental health. Absolutely.
It's really important, especially at a time like this. So I want to have a conversation with you about COVID-19. Everywhere we go right now, this is all we're hearing about on the news, social media. We're seeing social events being canceled, live events being canceled. And I thought we could dig into some tips that we could offer people about managing their own mental health and staying healthy that way, and also how we can help other people. So let's talk about how we can have a sense of calm in our lives right now with everything that's happening with this pandemic.
Right. Well, I think the most important thing to start off with is to make sure that you're getting your information from a reliable source, because I think a lack of understanding, a lack of education around what is COVID-19, what do I need to do to keep myself, my family, and my community safe, this is fertilizer for fear. It's what makes people feel more anxious, not knowing. And we don't have all the answers right now, but the most scientific answers, the most up-to-date answers, we need to get those from reliable sources. And whether it's the Chief Medical Officer for British Columbia or whatever province you're in, or the Canadian websites that offer that information, that's where you're going to get the best information. We all love listening to podcasts, and maybe we're on Twitter, so you can listen to those things for pleasure, but get your science from the right sources.
Let's talk about how we are as a society when something like this happens, because I think that's where a lot of anxiety comes from. So, when we turn on the news, we're seeing that everybody is hoarding things like antiseptic wipes and toilet paper. And it's created a panic in my own family where it's like, we need to go out and buy all these things and bring them home. Why do we do that?
I think we do that because it's not just viruses that are contagious, anxiety is contagious. And so even myself, when I'm watching these early newscasts and people are buying all this toilet paper, and I'm thinking, my goodness, should I go out and get some toilet paper? Wait a minute, we got lots of toilet paper here. What are people doing? Why is this happening? I think when you're not sure, you don't have all the information, we're all worried. And let's be honest, we don't know the whole story right now. So we're all a little bit worried. And then we see people reacting in a way that is different and unexpected. And we think, should I be part of that? Should I be doing that too? And that's why the information, the science is so important, where you get it, and making sure that, and telling your friends and family or encouraging them to do the same. And when you hear something that doesn't sound right, making sure you go and check it out and make sure that it is accurate.
I find too that a lot of times I do it myself, and I know I'm not the only one. You can be sitting, at home on the couch at night, and all of a sudden you start going down the rabbit hole of something on Twitter or something on a website somewhere, and next thing you know, you're feeling very scared. Should people be shutting things down that maybe are feeding into their anxiety?
I love that you said that, because I think people do go down those rabbit holes, and they then feel, more anxious, more concerned. What should I do? Turn it off. If you're getting information that is causing you to worry, you're not able to be sure whether that is actually accurate information, turn it off. Get out of that. Go to a site that gives you the correct information, and the best information we have is from the chief medical advisors from the province that you're in or from Canada. do not follow yourself down those rabbit holes, because the more time you spend there, the more time you will spend there. Your brain just becomes patterned into that worry. Being able to pull yourself out, go do something that distracts you for a period of time, then come back and have a look and go to reputable sources. I think we're spending a lot of time on this because it's so important, because there's so much inaccurate information, and even in some countries, information coming from leaders that is actually making the fear worse. So we really do need to spend a lot of time saying, go to the right place, get the right information. If you're getting freaked out by what you're reading, get away for a while, distract yourself, and then come back and find a reputable source.
Let's talk about taking care of each other. It's, one would think that watching people run around hoarding stuff is not thinking about other people. I'm really worried about people who are already isolated, whether it be elderly people, people with disabilities, maybe people that don't want to, go out to get the things they need, medical supplies or whatever they might need, if they can even find them right now. So I think there's a couple of things here. One, there's the virtual care to talk about and how people can access that. And then maybe after we talk about that, we can talk about how we can help our own neighbors.
Okay.
So virtual care, let's talk about how that works for somebody.
So what we're trying to do is keep people out of situations where they're more likely to be exposed. I think if we start off with, we know that there are a whole lot more people that have been exposed to this virus than we know in a population. We know that there are a lot of people walking around that are probably asymptomatic or have very mild symptoms. They're not going to be tested, but we know that the virus is out there. This is why we're getting these recommendations about social distancing, which essentially means having at least a meter of distance between anyone else that you're meeting in any kind of situation. That's supposed to protect you from not having droplets from that person if they cough or they sneeze. So we shouldn't be touching each other, and we should be staying at least a meter away and not being in environments where we're likely to be exposed to people easily. For instance, going to movie theaters where there's a lot of people squished together in a small area, because we're more likely to be touched by them. If they're coughing or sneezing, we're likely to get that on us. That is, we know there's evidence to show that that's one of the most protective things we can do. The other most protective thing we can do, wash our hands. And when we have to touch things that could be touched by other people where we could spread that, don't touch our face and wash your hands as quickly as you can. Why not touch your face? Because you got eyes, nose, and mouth, all ways to get inside you. So your hands touching your face mean that you're going to move that virus inside you, keeping your hands washed. So why are we talking about virtual care? Because going to a doctor's office where there's other people sick, where you may be squished together with someone or touching a surface or the elevator button that they've just touched and don't wash your hand right away, that could be a little bit of a petri dish for making you sick. So hospitals, outpatient units, we want to try to avoid those as much as possible. The opportunity through virtual care is to be able to get on with a doctor or nurse practitioner, get the information you need to determine where you should go if you are sick, what the next step you should take, without having to be around another sick person.
It's pretty amazing that we can do that.
It's amazing. And I think young people are picking up on this and love this idea. They're much more comfortable with it. We got to get everyone doing this because we don't want people going to the emergency room or their doctor's office, anywhere where they're more likely to pick up illness. It's best to try to go through a virtual care network to be able to get care, or at least to know what the next step is that you should take by someone who's able to, who's a medical professional and able to know what the next steps that are appropriate are.
We also need to think of all of our healthcare professionals that are looking after us. We need to protect them.
Exactly.
From, they need to stay healthy so they can look after us, because we'll be in big trouble if they all start getting sick too.
So we're not worried about young people at this point. And I want to remind people, we have a lot of information. We don't have all of the facts yet, but we do have a lot of information because unfortunately, more than 100,000 people have already gotten sick. So other countries are further along in this pandemic. They have more experience and we're learning from them.
100,000 around the world.
Around the world. So we have that experience. So we know young people, most of them will be asymptomatic or maybe have very mild symptoms. We think that they can spread the illness, however. So, well, we have lots of young people running around and still touching each other and being close together. They can spread it to each other. That's fine. But what we worry about now is elderly people, people with chronic illnesses, immunocompromised people. So someone who's going through chemotherapy, for instance. Those are the people we have to take care of. From an illness perspective, but also as human beings. We are judged as a society by how we treat our most vulnerable members. And right now, our elderly people, people who are immunocompromised or have chronic illnesses, they are the most vulnerable. We have to start to make plans right now. Mm-hmm. How do we help them to stay away from crowds? We don't want them to go to grocery stores. Maybe you have a neighbor that needs some help getting their groceries. Keep your distance, but help them. Maybe reach out to people that are isolated, because I share the same concern about loneliness, mm-hmm. being isolated, being afraid to go out. Reach out to people that you know don't have a lot of contacts and maybe provide them with a little more support. So there are lots of ways that we can help those who are most vulnerable. And hoarding means that the people that are more vulnerable, who are less likely to be able to get out and get their elbows up and get what they want, they won't be able to get stuff when they need it.
Loneliness is really a concern, especially when it comes to mental health, because we know that if you live on your own, you're elderly, or maybe you don't have any family that lives in the province, or whoever, loneliness comes in all different shapes and sizes. This could add an extra layer to that if people aren't socializing, people aren't reaching out, but again, we can use technology to socialize still. I had a glass of wine with one of my friends on FaceTime last night because we couldn't get together. And so, it's really about reaching out to your neighbor too, isn't it? And extending a helping hand, or even a hello, how are you?
It's interesting because we've never been more socially connected and we've never been lonelier. And so that's why I was talking about the idea of connecting with people that you know. It's one thing to be online and you're tweeting to a gazillion people that you don't know. Making a real human connection with someone, letting them know you care, that you're thinking about them, a FaceTime experience with someone that you haven't talked to for a while that you think may be lonely, making a human connection is really important right now.
Can you give us any signs about how we would know if somebody is really struggling with their mental health through this over the next few weeks? If maybe they're, really scared, or their anxieties, what are some signs that we can look for in other people to know that they might, need a little extra care?
I think all of us are a little bit anxious. I think if we're honest, we're all not sure. We don't have all the facts. There are already people out there that are struggling with anxiety or their mood or symptoms, or feeling quite isolated already. So I think many people are not necessarily going to be open with sharing what's happening. I think you ask the question, how are you doing? Are you finding you're coping okay? Are you finding that you're feeling lonely? What can I do to help you to feel less lonely here? Because I don't know that it's easy to figure out what's happening on a phone call with someone if they're not willing to share. But if you ask questions specifically and draw them out a little bit, that can help to understand what's going on.
Mm-hmm. Yeah. So it's about communication, not being afraid to reach out and asking hard questions to somebody you might be worried about.
I think that's the only way, really, is to reach out, to communicate, to let people know, I am worried about you. Tell me what's going on. What can I do to help? Some people don't want help, but asking and offering, I think, is valuable.
Okay, and let's just one more time to go back to this. If somebody, if you have a friend who's like, listen, if I get this, it's not a big deal. I don't have to worry about it. I'll be fine. So I'm going to go out and continue on with, everything that I normally do. Is that irresponsible in your eyes?
Of course. I mean, that's antisocial behavior, really, isn't it? You need to make sure that you're not just thinking about yourself, but our entire community. People are losing their loved ones because they're ill or they're older. I know I'm deeply concerned about my in-laws who are in Nova Scotia, and they're in their 90s. Mm. They are the most vulnerable group. So we all need to be responsible and follow the rules that are laid out by our health authorities, because otherwise innocent people who are just going about their lives are going to die because you want to make sure that you can go to the movies or whatever it is you want to do.
Somebody described it to me as, people who don't understand what ableism is. This is a perfect example of ableism, when you can walk out and say, well, if I get it, I'll be fine. I'm a healthy, 40-year-old or whatever it might be, because it's you're discarding people who, don't matter because they're older or disabled or already sick. And it is ableism, right? To only think about yourself and not think about others. And you're right. The best thing we can do is stay home, stay safe, wash your hands, do all of those things. So now we're doing all of those things, and we are, taking care of our neighbors. And what are some let's talk about kids for a minute. So I have 3 small kids, and they're scared, but they don't know why they're scared. And we talk about it and we explain it, and their grandma is 80 years old. And so we've explained all that. How do we talk to kids or teenagers that might be feeling scared themselves that they're going to get sick or get their grandparents sick?
Well, I think you made the point in saying, you have young kids. It's very different to talk to them than to talk to older kids. I try to make sure I don't give too much information, and I ask questions. You seem a little worried. Are you worried about this? What are you worried about? Let's answer the questions that they bring to you. For older kids, I want to make sure that they're not reading things on the internet that are seeding fear, that are not science-based. So if I'm, first of all, asking a question, are you worried about this at all? No, I'm not worried about you, sure. And then if they come back with some questions, making sure that if you don't know the answer, that you go online with them and make sure they're looking at reputable sources.
Mm-hmm. And how do we protect our grandparents and, people, like how are you handling your relationship with your mom, right? So your mom lives here?
Yes.
Okay. So will you go see her and everything's fine because you think you're healthy, or how does that work?
And I think that gets back to our concern about we can be asymptomatic carriers. So all of us should be working with this social distancing, making sure, and, kids, we know that they can get sick. There are many kids that are walking around with this right now. We don't know. Not having grandchildren hanging out with their grandparents if they're not able to keep that social distance, because we want to protect the most vulnerable. But talking about my mom, because I think I'm at this place of telling people you need to control what you can control. We can't control that this is happening. We can't control what's going on with the economy or the fact that we're facing this pandemic. What we can control is washing our hands and doing the things that we know will protect us. The evidence shows us are most protective. And we also have to take care of ourselves. So I did get a call from my mom saying, I'm afraid to go outside. The best thing for her right now is to go outside, but to be very careful when she's going down the elevator, that she's wearing gloves and pressing the buttons. She washes her hands as soon as she gets home. Being outside in nature, we know is helpful. It's calming. She's going to behave much more differently if she has to go to the bank, for instance. Then she's going to make sure she's keeping her social distance, that she's very careful with her hand washing. She keeps her hands away from her face, that she keeps a distance with the teller and with other people in line. But I think we're at a point now, the spread is still low, that we want people to go outside, and we want them to go on with their lives, but to control the things they can control with hand washing and distancing. When you're at home, what are you going to do with your time? You got to do self-care. You have to make sure that you're sleeping well, that you're eating healthily, that you're keeping up your routines. Exercise is a treatment for depression and anxiety. And unfortunately, those things that we usually do to take care of ourselves are the first to go out the window when we're stressed out. Everyone should be trying to keep their routines as close to normal as possible, taking care of themselves, doing things that they enjoy, because we don't just have a week or two of this. This is going to go on for a while. And if we don't maintain healthy routines, this is going to destabilize people, particularly ones that are more vulnerable.
Would you recommend going to a place like a gym right now?
I wouldn't recommend older people go anywhere where there are large groups right now. And older, I know I'm getting closer and closer to older every day, but the health officers are recommending anyone who's 60 and over should make sure to keep their distance. So not be in places where there are large gatherings, and always being able to have at least a meter away from someone wherever you are. But I think everyone should be avoiding those gathering places, because if you do get sick, you can spread it to vulnerable people. Where you should be going? For walks. in nature as much as you can, going out on your bike, those kinds of things where you have a safe distance from other people, but that you're around the trees and the grass and you're moving your body and you're not feeling isolated at home.
You can get some good meditation and yoga classes online too. There's lots of them. And what about masks? Let's talk about masks. Do we need to be wearing a mask when we're out?
So the evidence is clear that masks will not protect you. And in fact, once you've got a mask on for about 30 minutes, it's no good anyway. The value of a mask right now is that if you are sick, trying to prevent droplets from spreading. What makes me distressed about all the people that I'm seeing wearing masks is that we have a shortage of masks for people who actually need them, including healthcare professionals. I heard on the radio the other day, dentists are having trouble getting masks. So this is a socially irresponsible behavior to go and buy up all these masks when they make no difference for the average person as far as whether they're going to get sick or not. What makes a difference? Washing your hands, not touching your face, and keeping a social distance.
Okay, and just to wrap it up, we've talked about loneliness. We've talked about what we can do. What are the top 3 things you think for someone that is, staying home as much as they can, being responsible with their social distancing? Top 3 things that we can do to keep our minds healthy.
I would say the number one thing is trying to keep the usual schedule or patterns of your life. You may be working from home now, but trying to get up at the same time, go to bed at the same time, trying to make sure you get the best sleep you can, eating healthily, include exercise in your everyday life. All of those are healthy aspects of life, even more important now that our usual patterns of life have changed. I would say talking to your kids, keeping about this and making sure that they understand in an age-appropriate way, looking and making sure the facts that you have are correct, and protecting the others in our community that are less safe, the most vulnerable. Reaching out to your neighbor, giving some money to the food bank right now, because as we're having some shortages, people are going to be, who might use food banks are more vulnerable to losing their job with the whole economy right now. So reaching out to others who are more vulnerable, again, keeping your safe distance from everyone.
There's a lot going on right now.
There's a lot going on, and we already know that people are struggling with anxiety, with depression right now. This is adding to people's anxiety. How do we reduce that? Knowledge, knowing what the science is, and using the tools that we know work to help to keep us safe.
Amazing. Thank you so much, Dr. McIntosh, for being here with us.
It's my pleasure.
Really appreciate it. You have been listening to the TELUS Talks Health podcast. Remember, you can go to telus.com/COVID-19 for all the information, up-to-date information that you need. And you can also follow TELUS on Twitter @TELUS or @TELUS News.